This will be the new Erasmus Medical Centre. When complete, it will be an ultra-modern hospital where patients and visitors will feel at ease, a pleasant, productive and professional environment. At the same time, it will be a building where staff will work in an efficient and stimulating atmosphere. How was this new hospital designed? Experts started thinking about it early this century. Aiming to bring together all clinical functions in one modern complex, they were looking to create a compact but airy and well laid out building ready to provide top-level healthcare. The keywords were daylight, space and clarity. Whether you will enter from the garage or the main entrance, you will always find yourself in the main central boulevard from where all departments will be clearly signposted. There will be shops, restaurants, numerous facilities and various specialist outpatient clinics. Many facilities for staff will be on level 0 or the ground floor under the main boulevard, such as automated uniform distributors, bicycle parking, cloakrooms and a logistics corridor. The second and third floors will house outpatient clinics. In addition to the intensive care unit or ICU, level 4 will also house day treatment centers. The fifth floor will house the radiology department. Operating theaters will be on the 6th floor. The nursing wards will be on levels 8 through 12. These will provide patients peace and quiet with some magnificent views and access to the remarkable roof garden on level 8. This functional layering approach to design will reduce the flow of people on the upper floors, so the higher you go, the quieter it will become. Designing a new hospital basically progresses from the rough to the detailed. The first step is a structure plan. How will the building fit into the local surroundings? The subsequent floor plan then positions the various functions within the building. The space required by the many activities are defined in a program of requirements, which are then translated into detailed drawings. With the help of consultants and representatives of user groups, the plans and drawings are repeatedly compared against the operational objectives and legal requirements. The senior program consultant keeps track of all design steps recommended and taken. He supervises the design process and translates needs onto the building plan as fully as possible. Layout and other concerned specialists explain the plans to interested parties at a so-called design cafe. When agreement is finally reached on the plans, a contract document is officially drawn up. This records the agreements made between users, designers, and the new building project team. Such factors as daylight, patient flows, and the physical orientation of patients are very important, especially in the outpatient clinics. The reception desks are centrally located and can't be missed by patients and visitors arriving by stairs or lift. The corridors and waiting areas will run along the facade of the building and have access to plenty of natural light. This will result in a pleasant atmosphere and a view of the atrium, with the facade also serving as a clear orientation point. The treatment rooms not located near the facade will provide necessary privacy with top windows giving natural light. A distinction has been made between rooms that are used intensively and those used less intensively. The rooms that are typically busy will be close to waiting areas. The rooms used less frequently will be further away from waiting areas. This will reduce patient movements and ensure peace and quiet. Physicians will make use of quieter back office areas to work, consult with colleagues, and prepare for consultations. The outpatient clinics on levels 1, 2, and 3 will all meet the same requirements, which means they will also have similar layouts. This offers advantages for the efficient deployment and future flexibility of staff and space. The fourth floor will house a department new to Erasmus MC, the Integrated Day Treatment Center. Today's medical technology increasingly means treatments without the need for an overnight stay. After a minor intervention, chemotherapy, or a series of diagnostic tests, patients will have a comfortable stay at the day treatment center until they can go home. This department's high patient turnover will mean that logistics is very important. It will be a frequently visited part of the hospital, which is why there will be easy access from the parking garage and to the operating theatres. The intensive care unit will also be housed on the 4th floor. This is strategically placed for easy access to emergency rooms, operating theatres and clinics. All ICU rooms will have a workstation in the corridor just outside the room. This will eliminate the need for a central control desk for all beds, as is the case now, and raise efficiency. Level 5 will house the radiology department. The operating theatres will be on the 6th floor. Bringing together most operating theatres in the new hospital will also mean improved efficiency. Currently, the different locations require 3 emergency teams on standby. The new design will suffice with 2. Both the trauma operating theatre and the ICU will be strategically situated and quickly accessible. The central sterilization department will be immediately next to the operating theatres. This will improve on the old situation, as it will mean shorter distances and easier logistics. These carefully studied layouts will ensure that all functions are easily accessible for staff, the process of functional layering. The nursing wards will be on the top floors. It will be quiet here, and the views of the city, the port, and the green roofs will be spectacular. The nursing wards will be single rooms around a spacious central hall to be used as a sort of lounge. All rooms are now single rooms and will allow patients to have more frequent and more intensive contact with family and friends, as well as with physicians and nurses. The quality of healthcare will improve and the healing process accelerated. Single patient rooms reduce noise, traffic, and patient stress, and the risk of infection and medication errors. The nursing wards will also have a communal area where patients can eat together. As soon as patients are physically able, nurses will encourage them to make use of the communal area and the lounge. The new nutrition concept will give patients healthier choices and greater freedom of choice. Menus will offer a wide selection. Patients will decide their own meal times. The traditional nurses' stations will be replaced. All data and records will be stored electronically. The Central Control Desk program for implementing the new digital environment will provide software-based architecture and all required support. The patient rooms have windowless doors. Doors without windows give patients complete privacy if so desired. However, nursing staff will always have access to be able to check on patients. Rooms with an anteroom, however, will have doors with windows. This will offer contact with the outside world through a closed door. The design, dimensions, layout, and cleaning of all single-patient rooms, as well as all other design choices, were extensively tested using mock-ups. In 2017, the new building will open and offer the highest quality surroundings for the highest quality healthcare. While admittedly, a building is just a shell, it will actively aid staff in bringing top care to patients and the highest standards to medical treatment, education, and research. It is a hospital we will be proud of.